مرحبا رابعة.
أهلا دكتورة.
اوكي يعني مو شايفة غير اسم exit minimized. اوكي so في حوالي 80 موجودين سنة رابعة. سامعيني بوضوح؟
دكتور سامعين دكتور. ايوه
طيب excellent. اليوم it will be مش راح نطولها كثير اليوم. It will be I think maybe a short discussion. رح نحكي عن ataxia. We will be discussing acute ataxia, a child presenting with acute or subacute ataxia. We'll keep it short لأنه a lot of the differential diagnoses that we'll be talking about today may be يعني a bit new to you. Okay. خليني أحاول أطلع ال You can all see the PowerPoint presentation.
Yes.
Excellent. I don't know how much يعني قديش داومتوا خلال البيدياتريكس.
ما داومنا دكتورة.
ولا شيء دكتورة.
At all.
ولا يوم دكتورة.
ولا يوم. Okay. يعني it's unfortunate, a bit problematic. Hopefully يعني خلال الروتيشنز القادمة. Hopefully خلال السنوات القادمة you will have يعني ample opportunity to see patients and examine patients for ataxia. I think there are lots of يعني YouTube presentations, maybe videos discussing يعني demonstrating ataxia, demonstrating cerebellar examination. I do highly encourage you to try to access those YouTube videos. I do encourage you to look up videos about how to perform cerebellar exam in addition to reading about it, or you can even practice on your family members. So I do encourage you يعني to try to make the best of it. It's يعني it's disadvantageous إنه أنتم ما داومتوا البيدياتريكس some of your clinical training may be cut short. But we'll try to make the best of it. عشان هيك I will keep it a bit short اليوم. A lot of the يعني of what we'll be discussing today is يعني probably new to you, مش سامعين فيه من قبل. So we'll try to keep it short to just try to introduce you to some of the common causes of acute ataxia in children. Acute ataxia in children is a common presentation. يعني we frequently see patients who present with change in gait or inability to walk بالأطفال. They present to the emergency department, بيجوا على العيادة. So let's start with our first case. نحكي about this patient who is a 2.5-year-old who presents with inability to walk. هلا frequently what happens بالأطفال إنه children will not come and say I feel unsteady, I feel ataxic. الأهل themselves, they will not say we think the chief complaint will usually not be ataxia. How do you expect the chief complaint will be in a 2.5-year-old who feels every time he tries to walk, he is falling? How do you expect the presentation to be?
إنه ما بيرضى يمشي. الولد بطل يمشي.
Abnormal gait.
Yes, excellent. Abnormal gait is an excellent. So common presentations.
دكتورة في مجال تكبر السلايد صراحة إنه كثير صغير.
صغير خليني أحاول أكبره. كيف أكبره؟ ما أعرف. Let me see.
دكتورة فيه اللي هو اللي تحت سالب وموجب تحت جنب علامة البرسنت 40%.
I see. زي هيك يعني.
أيوة شكرا.
Excellent. ممتاز. Thank you. Okay. So what happens عادة what they present with إنه they present with مثلا change in gait صح؟ Abnormal gait.
ممكن يجيب
نعم.
ممكن يجيب Dysmetria نحاول نعطيه شيء ما يقدر يمد إيده.
يعني Dysmetria is not commonly a presentation. Dysmetria is something that we usually pick up on examination. وعادة parents will not complain of dysmetria in a 2.5-year-old. They might say he's dropping objects. They might say إنه صار عنده tremor. لكن one of the commonest presentation هي refusal to walk. So these children بيجوا الأهل بيقولوا لك إنه هو مش راضي يمشي. He is refusing to walk. When a child feels and every time he stands up to walk, he becomes unsteady and falls, they become very afraid, but then they start refusing to walk, okay? When you have a child who has a gait problem, change in gait, falling, refusing to walk, what could be the underlying problem? هذا هو السؤال. It could be ataxia, صح؟ هذا عنوان the presentation تبعنا today is ataxia. لكن can you think of anything else that can affect a child's gait or cause him
orthopedic problem.
Excuse me?
orthopedic مشكلة orthopedic عنده
osteomalacia ولا شيء.
Okay,
Acute classic paralysis.
osteomalacia عادة will not present acutely, right? لكن orthopedic problems, they present usually with what? الطفل اللي عنده orthopedic problem, it could be pain, صح? Which could be musculoskeletal. So another cause for refusal to walk in a child is that the child has pain, which could be musculoskeletal. It could be back pain, it could be joint pain. How can you ask in the history عشان نعرف if the patient has pain or not?
يكون عنده trauma.
History of trauma is excellent.
إذا كان بيمشي وبيعيط ممكن إنه هون نحكي إنه هو بتوجع.
Yes, irritability and crying, okay? Refusing certain positions or movements, صح؟
دكتورة ممكن vaccination.
زي إيش؟ What do you mean by vaccination?
البوليومايلايتس مثلا.
So infection, osteomyelitis you mean? Or arthritis because after vaccination?
البوليومايلايتس مش له vaccination.
Yes, polio does have a vaccine. عادة the first vaccine عندنا بالأردن particularly is IV. The rest of the vaccinations are oral. We rarely see يعني significant infection or inflammation after a vaccine preventing the child from walking. يعني it's not too common. والpolio vaccine عادة does not cause يعني such complications. لكن
ممكن الجيليان-باري
بنحكي عنه كمان شوي. Does Guillain-Barré present with pain? Yes, it can present with pain. Okay, so one reason for refusal to walk is pain, right? سواء كان musculoskeletal, back pain, joint pain, even soft tissue pain, muscle pain أحيانا. Clues in the history, this is a painful condition, the presence of irritability, crying, a history of trauma, and certain positions. He's fine, for example, until we flex مثلا his knee. He's okay until we touch, for example, his hip joint, etc. So refusing certain positions. Other than pain, what else can be the cause of this? خلينا نحكي عن ataxia, right? It could be ataxia, صح? Maybe he has ataxia. How can we, what is suggestive of ataxia in the history?
ممكن يكون عنده prior respiratory infection أو GI infection.
Could be, although recent infections can also increase the risk of osteomyelitis or arthritis or reactive arthritis. صح؟ reactive arthritis after viral infections are not uncommon in children. صح؟ So recent infection, yes, but not particularly بتروح لعند الاتاكسيا بالذات.
ممكن loss of coordination.
Loss of coordination.
وبرضه بس يمسك شيء.
He walks unsteady بيحكوا إنه walks like a drunk ولو زي السكران بيمشي. Okay, ماشي الحال. He's able to stand alone, but once he's up, sways from side to side, falls, needs support, صح? He is walking in an unsteady manner. بوصفوا لك إياه like this, usually without pain, without irritability, without crying. What else can cause difficulty walking?
Stroke ممكن.
Stroke. So what does stroke cause إذا واحد عنده
ataxia.
why does the gait change?
أثرت على النيورونز.
How about weakness? اللي عنده stroke مش بيكون weak that's why they can't walk. صح؟
Yes.
So what is suggestive of weakness in the history? When we take history, what can lead us to think about weakness, or how can we ask about weakness in our history?
إذا بيقدر بيشيل حاله أو إذا بيرتكي على إشي وهو بيمشي.
Yes, excellent. Difficult with transitional movements. يعني unable to stand up from the floor without assistance. This is characteristic. Unable to get up to sit from lying down. Okay? هدول كلياتهم they tell us that the child is weak when you have a problem with transitional movements. يعني if he falls بقولوا لك إلها إذا وقع cannot get up from the floor without assistance. Okay? This is if you سامعين بالجاور sign. Yes. So this is similar to the Gower sign. إنه الطفل إذا قاعد على الأرض he is completely unable to stand up by himself unless he holds on to something. With ataxia, when the child, he does not need help getting up from the floor. Whereas it's the other way around with weakness. When the child falls to the floor, unable to stand up unless someone helps him, once he stands up, he does not have the swaying or the unsteadiness اللي بنحكي عنهم قاعدين. فهدول هم these three, pain, ataxia, and weakness, are the main differential diagnoses for a child who is unable or refusing to walk. We have to think of these three differential diagnoses. Today in
ممكن developmental delay أصلاً عنده.
So developmental delay إحنا اليوم ما بعرف ليش هيك تعمل. Anyway, اليوم الtalk تبعتنا is about acute ataxia, right? So children usually with developmental delay, they usually do not present with acute ataxia. اليوم الحكي عن acute ataxia, a child who is walking completely normally, and then over a day, over a few hours, over 2 days, he becomes unsteady and unable to walk. Okay, this is what we'll be talking about today. So, excuse me?
ممكن سؤال؟
Yes, تفضل اسأل، علي صوتك بس.
الاتاكسيا ممكن تعمل speech impediment؟
Yes, رح نحكي هلا عن ال signs of cerebellar disease. هلا رح نحكي. It can cause speech impediment. Excellent.
دكتورة drug ingestion
Yes.
بالغلط حتى من
Yes,
differential.
excellent. Drug ingestion. هلا اللي أنا عم بحاول أحكي هلا إنه the most important thing أول شيء to decide what the problem is. يعني إذا كان إحنا we decided إن the patient has pain بنحط drug ingestion on the differential diagnosis. No. إذا قررنا إنه the patient has true muscle weakness كمان as well بتكون drug ingestion not on the differential diagnosis. If we decide إنه المريض he looks like he has ataxia, then drug ingestion is on the differential diagnosis, صح? So the first step إنه أول شيء إنه to figure out what the underlying problem is. Why is this child unable to walk? Why is he refusing to walk? It's either pain or ataxia or weakness for the most part, okay? Think about these three issues and try from the history and your physical examination to differentiate between having pain, ataxia, or weakness. If the child has pain, زي ما حكينا, he will be irritable, he will refuse or resist specific movements. They usually don't have يعني pain everywhere. لكن specific movements and they assume specific postures. You might see redness, you might see swelling with pain, صح؟ Ataxia, we will do a cerebellar exam رح نحكي عنه كمان شوي. With weakness, we concentrate on transitional movements. يعني getting up, بيكون مريض نايم, asking him to sit up from a laying down position, asking the child to stand up from sitting down on the floor. Difficulty with transitional movements is indicative of having pain, weakness, I mean, okay? هلا لما نيجي على الفيزيكال اكزامينيشن في عندي هون انا حاطط لكم a couple of links, this one and this one. I found them on YouTube. One of them was through the American Academy of Neurology باللينك اللي عندي. Both of them I found to be quite helpful. One of them is a demonstration of an ataxic patient walking, and another is a description of ataxia. And one of the staff members is imitating ataxia, trying to discuss it. So both of these links are helpful if you can go back and try to go over them. Cerebellar examination. مثل ما one of your colleagues mentioned. How do you do cerebellar exam? The first thing is you ask the patient to say a full sentence. مثلا, their name in full. But try to avoid yes/no questions. So that you can hear the patient speak. With cerebellar disease, you will have something called cerebellar dysarthria. Again, it is very similar to talking while under the influence of alcohol. It's like alcohol intoxication. Actually, alcohol intoxication is similar to cerebellar disease because alcohol is toxic to the cerebellum. عشان هيك إذا بتحضر بالمسلسلات أو someone has seen it, لما يكون حدا driving under the influence شو بيعمل الشرطة؟ They ask him to do a finger testing, but they ask him to do Tandem Gait, صح؟ إذا بتشوفوها بالأفلام أو بالمسلسلات. Okay, so cerebellar dysarthria. The next thing in the ocular manifestations, and you can have many ocular manifestations with cerebellar disease, like in nystagmus is the commonest. Again, I would encourage you to try to look up YouTube videos about how nystagmus looks like. And hopefully you'll be able to see it one day on one of the patients in the floor or in the clinic or what have you. Impaired finger testing, which is called intentional tremor. And of course, remember, bilateral examination, okay? Remember to always do bilateral examination. Frequently, cerebellar diseases is unilateral, okay? So do bilateral. Remember, the cerebellum has 2 lobes, just like the central nervous system. Yes, question?
خصوص الاوكيولوموتر findings هذول كلياتهم لهم نفس الاكزامينيشن ولا كل واحدة لها اكزامينيشن مختلف؟
They look different. Nystagmus, you ask the patient to follow a moving object slowly from side to side. Nystagmus can be horizontal nystagmus. It can also be vertical nystagmus. With ocular flutter, you ask the patient, ocular flutter or square jerk ocular movements or opsoclonus, usually you can see them just by observing the patient. واللي هم عبارة عن most of the time هدول كلياتهم they are rapid conjugate eye movements. ماشي sometimes بقولوا لهم زي dancing eyes. Okay? We can see a variety of oculomotor abnormalities or ocular movement abnormalities with cerebellar examination. I think for your level, if you remember nystagmus, it would be excellent. Okay? Impaired finger testing واللي هي بنقولها intentional tremor. خليني, I'm going to try to see if I can find. I think I may have Dysmetria somewhere, one of my patients. No? Medical. Let's see. Dysmetria, no, معقول. Dystonia, ALS. Well, I guess not. Maybe on some other template أو على تليفون تاني أو شيء زي هيك. Okay. Again, if you can try to find YouTube videos showing you dysmetria, it would be very helpful. Once you see dysmetria once, it's very typical. They always look the same, okay? Have you ever seen, do you know what I'm talking about when I say impaired finger testing?
Oh.
Yes.
Excellent. يعني سامعين بالكلمة, you know what I'm talking about, right?
Oh.
Okay, excellent. Impaired rapid alternating movements. Again, bilateral, don't forget the other side, impaired heel to shin, and ataxic gait, okay? Patients with cerebellar disease will have a wide-based gait. They might have titubation. The titubation is shown in the videos that I pasted the links for you. Titubation means repetitive correction of posture. Yani when the patient leans to one side, rather than falling, they try to correct very quickly to the other side. فبتشوفهم كأنهم they are lurching from side to side. If the patient has a normal based gait, if you do tandem gait, then this will further stress the patient. You might be able to bring out ataxia with tandem gait. Again, in the videos that I mentioned to you, in those two slides, you will see impaired tandem gait. Okay. So try to invest some time to look up some videos about cerebellar signs and how to perform a cerebellar examination. Any questions on the cerebellar examination?
هذا full examination للcerebellum.
Yes, this is good. If you know these things, نكون لكم من الشاكرين. Yes, this is basically cerebellar exam that I would like you to be. Remember these things, man. Don't that, okay? All right. So, حكينا عن المريض. We mentioned that he presents with impaired gait. He presents with refusal to walk. لما أخذنا history وعملنا examination, the patient is not in pain. The patient does not appear to have weakness. On examination, he's able to turn over in bed. He's able to sit up when he's laying down. He's able to stand up from the ground if he sits down. But he had good anti-gravity movements. But he does not appear to be weak. Like, once we examine him, indeed, the patient is ataxic. He has titubation movements. He's falling. He's unsteady. He has a wide-based gait. So we decide in هذا المريض, after the history and physical examination, the cause of his problem is acute ataxia. All right. I did mention before, maybe to one of the groups, I think برابعة, unless it's with SATA, I don't remember, the mnemonic for the pathophysiology of the disease. I really like this mnemonic because it's called vitamins. This mnemonic applies to every single organ system. The body organ systems, they behave similarly, okay? So this pathophysiology of disease not only applies to just neurology, but it also applies to other organ systems as well. Vitamins, V for vascular, I for infectious or inflammatory, T for toxic or trauma, A, autoimmune, نسيناها. Okay, metabolic, M, endocrinological, neoplastic, and هنا هي P بس احنا حاطينها S to remember vitamins for psychiatric. This is the basic pathophysiology of disease. Like I mentioned, this can apply to all organ systems. Some of these may apply in certain situations, or others you may not find a specific application. In our case, in this patient who has acute ataxia, what do we mean by vascular disease? Like what?
Stroke يمكن أو TIA.
Yes, stroke, infarct, okay. What else? Vascular, hemorrhage, right? When should we think of vascular disease? When should we think of stroke, infarct, hemorrhage, سواء بالneurology or outside neurology? What makes you think of a vascular pathophysiology?
Trauma. إذا كان sudden أو very sudden.
Yes, absolutely. Acute presentation. So vascular insults are, بنحكي لهم, we keep saying there are catastrophic, okay? Acute or hyperacute. Okay, so when you have an acute presentation or a hyperacute presentation, a catastrophic presentation, this is when we think of vascular insults. So again, this applies to all organ systems. You will have an acute presentation if you have, for example, a renal stroke, you will have an acute presentation. If you have a pulmonary hemorrhage, صح? So vascular insults are usually acute. We do not think of vascular insults if you have someone with a presentation over a week. صحيح؟ لكن presentation over a few hours or minutes, this makes you think of a vascular pathophysiology. When should we think of infectious or inflammatory pathophysiological mechanisms?
إذا في fever, fatigue.
Excellent. Fever. Excellent. عادة it is subacute, right? It's not usually يعني within hours, صح? It usually takes a little bit of time. So the presence of fever, a subacute presentation. We can also have constitutional symptoms, صح? من malaise, lethargy, feeling tired all over. صحيح؟
صحيح.
Okay. Toxic trauma. شو بدنا نعمل to different to ask about a history of toxic ingestion or a history of trauma. صحيح؟ شو صار؟ Okay. With toxic ingestion, also typically we will have a fluctuating course. This is typical for toxic ingestion. Like بيكون كويس بعدين برجع he has decompensation. A few hours بعدين he's better again. Okay, this could be a toxic presentation, intoxication.
دكتورة بنحط الهيفي ميتال بويزنينج برضه بالتوكسيكيشن.
Yes, heavy metal poisoning could be with intoxication. However, not all intoxications present acutely. Heavy metal intoxications, such as lead poisoning, for example, presents in a subacute or chronic manner. صح?
Yes.
Whereas, إذا الطفل, for example, took a drug overdose, this presents in an acute or acute fashion. صحيح؟
تمام.
Excellent. Autoimmune phenomena, such as شو بنشوف بالautoimmune phenomena? We may
ممكن post infectious.
Yes, we may have fever, history of preceding infection. It's usually also a subacute presentation. هدول المرضى with an autoimmune phenomena, they do not present in an acute presentation. Metabolic disturbances.
We can already diagnosed with diabetes مثلا.
Excellent. That's what هذا اللي بطبعه قاعدة right now. اللي هو you have to have a suggestive history of a, for example, metabolic disease, such as DM, such as renal.
Thyroid.
endocrine هياتها تحت هلا بنحطها. Okay.
That was my bad. Sorry.
Also fluctuating
electrolyte disturbance.
Electrolyte disturbances, absolutely. So by metabolic, we mean metabolic acidosis, electrolyte disturbances, we mean hypoglycemia, we mean, hyperuricemia, we mean hyperammonemia, uremia. This is what we mean by metabolic disturbances.
Vitamin deficiencies كمان.
Vitamin deficiencies. Yes, هدول we could include them. Either we can think of them under metabolic or we could think of them under toxic. Endocrine, مثلا
hypothyroidism.
مثلا thyroid disturbances, مثلا complications of diabetes. Okay, هدول هم. وزي ما حكيت يعني we may find some of these apply to some differential diagnoses, and in other cases ممكن نحكي إنه this is unlikely. يعني in a child who presents with an acute ataxic syndrome, it's unlikely to have an underlying endocrinological abnormality, but we do keep things in mind. Neoplastic. How can tumors affect the central nervous system? Either directly, right?
ممكن mass occupying lesion.
By mass effect. وهاي عادة بتكون a chronic presentation. واو بقت مرة كتير سريع. We may have to do like another maybe 10 minutes نستعير من another session. Anyway بنشوف شو بصير معنا. Either directly by a mass effect in tumors, chronic presentation. When do tumors present acutely?
ممكن إذا Paraneoplastic.
with hemorrhage.
infrastructure.
This is when you have an acute presentation. ماشي. And زي ما حكى زميلكم a paraneoplastic ماشي phenomena. Okay, paraneoplastic. So tumors can either affect an organ system directly by mass effect or infiltration, صح? Which is usually chronic. Tumors present acutely if they have bleeding. Outside of bleeding, usually tumors present chronically, okay? Unless there's bleeding inside the tumor. When the tumor bleeds, بصير في عندها very rapid increase in the size. Or either indirectly through paraneoplastic phenomena. And the last differential diagnosis, عادة we have psychiatric manifestations or somatoform disease at the end, يعني at the bottom of the list. لكن with يعني experience, مثلا for me, it's easier طبعا for me to recognize a psychiatric gait disturbance than, for example, a resident or a pediatric specialist who's not a neurologist. So it takes a little bit of experience. عادة we say that psychiatric or somatoform disease, we usually like to say that it is a diagnosis يعني of exclusion أو بنخليه للآخر, okay? ما بدنا نحكي it is not a diagnosis of exclusion actually, لأنه أحياناً patients present with problems very difficult to diagnose. هذا مش معناته إنه it is psychiatric, right? فإحنا عادة نخليه at the bottom of the list. If it is consistent يعني with a psychiatric gait disturbance, then we might think about it. Okay? So these
حتى إذا عمره 2.5 يعني.
Of course not. هذا سؤال it's excellent شو اسمه excellent question. Not below يعني I wouldn't think about it. Not يعني below the age of خلينا نحكي even 9 to 10. I would be very reluctant to think of psychiatric disease below the age of 9 or 10. Okay, هاي مهمة كتير القضية. Yes, excellent question. All right, so this vitamins, try to keep it in mind. Whenever you see a patient present, think about this pathophysiology and think about what may or may not apply to your patient. But this is a good mnemonic to go by, generally speaking. Why don't we go ahead and schedule another Zoom? It will take me probably 5 minutes and we can be right back. You want to do that?
بصير.
Sure.
مش كتير هم يضلوا. We'll just go over some of the most important causes of acute ataxia in children. يعني بشكل مش رح ندخل فيهم بالتفاصيل كتير. We will wrap up, okay?
دكتورة ما في hereditary ataxia؟
Excuse me?
Hereditary ataxia.
Yes, في ورح نحكي عنها يعني لما نكمل رح نحكي عن hereditary ataxia. Usually hereditary ataxia بتيجي under metabolic. This is usually a chronic disease. يعني رح نحكي عن هذا الموضوع شوي كمان بالسيشن الثاني. We'll talk about how hereditary ataxias can present بشكل عام يعني. Okay, see you on the other side.